Complete bed rest wasn't comfort, it was a medical prescription. The instructions were simple. Do not rise, do not walk, and do not exert. Patients followed perfectly. Months later, they could not rise, could not walk, and could not leave the bed. Their compliance had worked. Doctors believed the nervous system required rest, complete rest and absolute stillness. Movement was agitation and exertion was harm. The body healed when spared effort. This belief was published in journals and taught in medical schools. Patients were placed in bed, not restrained but instructed. They were told not to move without permission and not to use the muscles they still had. Nurses monitored compliance, and doctors checked for stillness. Patients who stayed still were praised, and those who moved were corrected. Treatment continued for weeks and then months. In some cases, it continued for years. After prolonged rest, patients changed. They became quieter, weaker, and more dependent. They required help to sit, help to stand, and help to do anything at all. Charts recorded this as fragility, and fragility justified continued rest. The treatment created the symptoms that required more treatment. Doctors called this progress. Muscles atrophied, bones thinned, circulation slowed. The charts did not call this damage. They called it underlying weakness. Blood clots formed and pneumonia followed. Some patients never stood again. The outcomes were not blamed on the cure. Patients who could not rise were said to need more time. Those who died were said to have been too sick to save. Wards remained peaceful. There was no wandering, no falling, and no incidents to report. The institution measured stillness, and the treatment delivered stillness. There was no metric for what disappeared while the body lay motionless. Strength cannot be recorded if it is never tested. Rest cures faded when fashion changed. Activity became treatment, and rehabilitation replaced restraint. There was no formal rejection and no apology. The protocol was simply forgotten. Doctors were not cruel. They measured stillness and they measured quiet. By those measures, the treatment worked. Extreme bed rest did not restrain the body. It convinced it to stop trying. That is not malice. That is a measurement problem. And when stillness is the only metric, every patient who cannot rise has been cured.